Hello, Mommy Berries community. Brittany here, and I'm so excited about today's interview. I have here with us Dr. Kokes. Now, I want to tell you a little bit of a story about Dr. Kokes and I, at least how I came to know her, and then we're going to talk about a few different things today as far as female athletes returning to training, hormones, those types of things. So I met Dr. Kokes, was it about a year ago now?
Yeah.
So about a year ago, my children are a little bit older. So at the time, my son was 5, my daughter was 3, and working a full-time job, doing professional development, training as well, and kind of turning a spin to it being a little bit more competitive. So I had the aim of trying to qualify for World Masters in weightlifting, and the world seemed to crash in on me. I had hit a point where I just wasn't coping. Like I wasn't, my expectations of myself through day to day, the pressures I put on myself as a mom, as a therapist, and then as an athlete were kind of, they burned me out, so to speak. And Dr. Kokes really helped me get back on track with getting back to the basics of some of those pillars of health and helping me understand my physiology as a woman and how even my cycle, how I might alter my training around my cycle. So she's been profoundly helpful for me and kind of resetting my life down the right path. And so without more ado, I'd like to introduce Dr. Kokes. Can you tell us a little bit about yourself?
Yeah, definitely. So I am a naturopathic doctor and I'm a registered dietitian and certified sports nutritionist, I guess I would call myself. There's tons of sports nutritionist certifications, so I have one of them, I guess I should say. So yeah, most of what I work with day to day is female athletes, both on a one-on-one scale and a little bit more globally as well. And thanks for sharing your story. I know it's always a little bit difficult to kind of share the personal moments, but yeah, thanks for doing that. And I think hearing those things is super important for other moms and athletes as well. And you had a lot on your plate at the time, so there's so many things that we can do to help. It's just a matter of hearing the story and finding ways to improve the situations, you know?
Absolutely. Yeah. So why don't we start what do you commonly see with postpartum female athletes as a general rule?
Yeah, so getting back too soon and getting back too hard, I guess I would say. So unfortunately, social media and the world has told us this giant lie that the goal is to get back to your pre-baby body as soon as possible. And it takes about 6 months to a year to heal and to recover from having a baby. And I think that message gets lost a lot. Like I'm seeing a lot of pre and post pregnancy body comparison photos and stuff like that. And I'm proud of the women's bodies and the work that they've done, but I think it also sends the wrong message to moms to say that there is some sort of pre and post that you're supposed to get back to. And the timing of everything, like the ligaments stretch, the hormones are off. If you breastfeed, that's going to keep your hormones off for the duration of time that you're breastfeeding. So there's so much that's happening here, and we just have to really slow down and kind of listen to our body before we jump into something to try to, get back to our sport or get abs again,
Yeah, absolutely. I think this interview is going to tie in really nicely with a couple other interviews that we've had in our community recently. We had Isaac Smith and myself talk about training and exactly that, some of the skewed messaging that's out there on women and that pressure to get back so quickly. And then we've recently had a lovely interview around postpartum anxiety and postpartum depression and how that may manifest. And I feel actually considering all of these things together is really important in this demographic. So can you talk a little bit about what we now define as relative energy deficiency in sport, or REDS, was formerly understood or known as female athlete triad?
Sure. So I'm doing kind of a lot of work in this area, and not necessarily for postpartum athletes, but just for female athletes in general. And what we assumed was, so we'll give an athlete not enough fuel and get them trained too hard. And then we start to see um, body composition dysfunction. We start to see hormonal dysfunction. We start to see, predisposition to osteoporotic changes in the bone. And obviously all of these long-term consequences that could possibly go with that. So what I'm really seeing now in the literature, and what I'm really kind of like seeing in the people in front of me, is food is one part of this really of this like life bucket, let's call it. So if we're under fueling you, which tends to happen especially with the first baby, because it's shocking how many calories you need to especially if you're breastfeeding as well. It's mind-blowing, first of all, how much protein a woman needs, how much protein a woman needs who's training, and then how much protein a woman needs who just had a baby, right? So
Yeah.
these demands keep going up and up, and caloric demands keep going up and up, while everyone's telling us to cut back and cut weight and try to lose the baby fat. So it's
Right.
such a difficult time for a woman, I would say, especially with all of the social media information out there versus what your body actually needs. So even on the day-to-day, everyone's sitting in front of me, never hits protein targets, never hits food targets. And when I give them the targets that they need, they're shocked by how much food it actually is. And there's such a fear around that's going to make me gain weight. And I'm like, this is literally just trying to make your body survive. Like, this is what it needs to function, let alone put muscle mass back on and that sort of stuff. So I think that real clear conversation is difficult at first, but has to be had with everyone for sure. The next piece of things is these other things that fill up this bucket that eventually leads to what I like to call under recovery. I think our bodies are capable. I mean, like, look at the miracle of life. Like, we're so capable of the most amazing things, but we have to have all of these tools in place for us to be able to do that. And back in the day, we missed a whole generation where we used to live with family members. We used to see pregnancies. We used to see the history of how a baby was born, and then have so much care afterwards of people in the family around you all of the time. And now there's this mom who's trying to get back to work as quick as possible, full time, no childcare, or has to give her baby to someone she doesn't necessarily know through whatever childcare is available. And then the demands of the job come back in, and then on top of that, you're trying to get food in the system. So there's so many like actual and perceived stressors that are happening to the body, that coupled with not enough food, with poor sleep habits, which are obviously going to happen with a newborn. It's just a recipe for disaster.
Yeah. It's it's actually quite amazing when I can reflect back to when I had both my children as newborns, and it could be like a week go by and you're like, wow, did I shower this past week? Or, what have I eaten in the last week? So do you have any strategies, like maybe in that earlier window, that moms could use to try and fuel more? Because it's mind blowing how difficult it is to actually get enough food in our system.
Definitely. And I think too, I should have said this at the very start to preface it. I don't have kids yet, and I'm so fortunate to learn from all of these women that are sitting in front of me. So I know there's some of these suggestions will hit and some of them will miss. Like, you just wait till you have kids. Once you say bear with me ever so slightly for that, but I do get to learn from all of the women sitting in front of me. So that is kind of an advantage for me for my future, I would say, if I'm so lucky to do so. So for tips and tricks, hydration is obviously key. So whatever sets that up for you for success, whether that be, a water bottle that's like constantly around. Another huge thing is asking for help, which is so difficult to do because we've been preconditioned to believe that we're supposed to do this all on our own. So when I say ask for help, like, it's very difficult for us to ask a friend to like do the laundry, but like, do it. That's what you need right now. They'll be more than happy to help with that, especially if you don't have a lot of family in the area too. So use the people around you, because that's how it was supposed to be designed. That saying, a village raises a child, is truth, right?
Mm-hmm.
Another thing is just have like Costco snacks, you know what I mean? Just have them everywhere throughout the house, and make sure that, they are quite protein rich. So nuts and seeds and cheeses and even like rotisserie chickens and stuff, easy stuff that you can just pull off and take a snack with you, because there's not going to be a lot of like meal prep time, and the time that you do have to do anything, you're going to want to sleep, I would say, you know?
Yes.
So even like protein powders and stuff like that to get into your system, essential amino acids, kind of just mixing those in your water bottle throughout the day is going to be key, just to get those protein levels up, because your body needs them so badly at this time, especially to recover from everything that just your body went through, you know?
Yeah.
And then like, again, asking for help from your partner, asking from help for anyone basically that's around, to be like, I need protein, I need this, I need this. And we always feel bad doing those things, but if I could emphasize anything, it would be ask for help at this time. It's not possible to do this all on your own, and it wasn't designed to be that way for the most part, you know? Whether it used to be like, you know, groups of women together all raising the children versus, you know, having partners that would help way more. And the real difficult part, or the real challenging part, is we often believe that it's just easier if I do it, but that's even taking more from that bucket of health that you have left. So even if it's not done perfectly and the chicken's not done the way you like or whatever, just kind of get food into you. And then on the luxury side of things, there are meal delivery services, right? Like good food baskets. And I know that's not available to everyone due to financial constraints, but even like 1 or 2 days a week where that burden is taken off of you could be huge, you know?
Yeah. Oh, those are great user-friendly tips, I would say, for that early on. What about can you speak a little bit to the nervous system, and how in the time of new moms, we can get kind of potentially skewed or stuck in more of a sympathetic state? And I'll let you kind of define that or explain that for our listeners. But how does that play a role, and what are some really key tips and tricks that women can utilize to kind of balance the nervous system response?
Definitely. So our autonomic nervous system has 2 branches, sympathetic and parasympathetic. Sympathetic is that fight or flight response, and parasympathetic is that rest and digest response. So there's the whole whirlwind of things happening postpartum where, you know, the 3rd trimester, your hormones are at the highest peak they will ever be, ever in your life. And then, you know, 2 to 3 days after giving birth, they drop to, you know, the lowest they'll be until you go into menopause. So that hormonal fluctuation is wild. So I think have a lot of forgiveness with yourself at this time. And I mean, based on your experience for pelvic floor therapy, like I often recommend just like chilling in bed for a few days, just relax. All of these changes are super intense that are happening. So it sounds mean to say, but you're not really like a functional human at that time. We took such a big gap between your hormones that it's no wonder that, you know, brand new moms are quite, you know, teary, and all of these things are happening at once. So have forgiveness within the first couple weeks for yourself, for sure. The next thing that I would say is perceived stress is the exact same as an actual stressor in the body. So every time we think of the baby being like, gonna fall off the bed, gonna need this, gonna, you know, all of these things that we kind of essentially anxiety wise make up in our head still elicit the same stress response as, you know, something actually going wrong or something actually really stressful in our lives. So kind of keep mind of that as much as possible. And it's going to be difficult. There's so many new challenges and stuff, and that is tough to mitigate, but just I think being mindful of that is step one. Like that is kind of, you know, putting your body through a stressful state and keep you in that sympathetic response. And I'll kind of get to some tips and tricks after. So basically what happens is anytime we have a stressor, whether that be perceived or actual, our brain, the hypothalamus in our brain releases so in a normal functioning system, gonadotropin releasing hormone comes from the hypothalamus. It goes to the pituitary to release FSH and LH, which goes down to our ovaries to release estrogen, progesterone, and testosterone. So that's kind of like a normal functioning system. And then anytime we have these stressors, gonadotropin inhibiting hormone starts to come in, and that shuts down that whole process. So even like years out when you're hoping to get your period back, or a few months later and it's still not coming, it could be because of these stressors that are actually, you know, hindering your body's ability to do its normal thing. And progressionally over time, kind of what happens is as cortisol gets released which is our stress hormone, time and time again, it puts us into the state of hyperadrenaline. So you're basically living off of adrenaline now. And new moms probably feel this tenfold because they get that cortisol release anytime the baby cries, anytime, you know, their breasts hurt, anytime. There's so many stimulants that would cause that. So just being mindful of it is the first step, and all I could ask for you to do, that all of this is playing into this big system. And then adding exercise on top of that seems insane to me. And I get it. I get the goal of it, to try to, you know, get bodies back as soon as possible and feel yourself as soon as possible. But I promise you, if you take the therapeutic time to kind of work on these things first and then move into exercise, you're going to be leagues above, you know? So for tips and tricks for a lot of these things, it sounds funny and easy for me to say, is like rest when the baby rests. That's a huge one, because sleep deprivation is going to wreck this whole system. And there's a given sleep deprivation that's going to happen for new moms anyway. But anytime you can catch them shut eye, don't do laundry. Don't put it, sleep should be above everything at this point. So let's definitely keep that in mind. Food is another thing. So if we're under fueling, certainly that's going to initiate that stress response as well. So anything that you can do, as I was kind of talking about, tips and tricks just to get food into you, is huge at this point. And everyone asks, like, what food? And like, high protein foods. You need carbs at this time. Please do not avoid carbs at this time. And fat too. Your brain needs fat to function, right? So all of this stuff is going to be super important at that time. And then, as much as we want to get back to exercise, I think the most therapeutic thing that you could do for your body at this time is anything that is long, slow breaths. So walks out in nature with the baby, or even if you can have 10, 15 minutes to yourself where you go for a walk in nature and you kind of look at things and breathe as much as possible. So with this sympathetic hyperadrenaline state, we start to breathe from our upper neck muscles, and we're not getting full deep breaths of air. So even if you could take a couple minutes in the day and focus on 5 seconds in, 5 seconds out, 5 seconds in, 5 seconds out, and that should be your breath kind of work routine. As much as you can do that throughout the day, that's going to help that nervous system get the oxygen and carbon dioxide ratio that it needs to function well. Another huge thing is kind of like bonding with the baby. For the most part, all the oxytocin is released at that time. And of course, there's some situations where postpartum can kick in, but it's funny enough, we want the baby away from us a lot of times in postpartum, whereas the baby close to us would probably be the most therapeutic thing we can do there. But it's a really tough time, and a lot is going to be going through your head. So do what you can with what you have for the most part. Singing, gargling, all of these types of things stimulate that vagus nerve too, to help calm down the nervous system. And there's a bunch of supplements too that are pretty safe postnatally and during breastfeeding that, you know, you can try. And I definitely recommend talking to a practitioner to see if you need some additional help there, because if you're living 10 out of 10 the whole time and then trying to add exercise on top of that, like, it's really just a recipe for disaster.
Right. Yeah, no, that's, I really appreciate you taking the time to highlight some of the other pillars of health that are so important. Because I see it all the time with the new moms. They come into the clinic with this perceived pressure of getting back, like you said, and they're under the impression that if they exercise more, they're going to get the results. Mm-hmm. And I always like kind of lay it as a pyramid scheme. Like, sleep is on the bottom of the pyramid and really should be the greatest priority to new moms. And like you said, like, the best recipe is rest when you can, nap when the baby naps if possible, or if you have someone around to help out, to take a nap in the day. I personally did this with my second versus my first, and my recovery was profoundly different in those early stages. And then the next pillar would be nutrition, stacked on top of that. And then you're looking into like general movement, and then looking into more kind of sports specific movement as we get to the top of the pillars. And I think when I say what I say to patients, I don't know how you feel about this, but I'm like, 80% of body composition changes can actually be achieved around nutrition and doing the right things there, and sleep, because inadequate sleep will actually influence hormones and our metabolism with the nutrition we do take, or our ability to make good nutritional choices, even when we're in that really sleep deprived state. So yeah, I appreciate you laying a foundation on, you know, those other things that are so critical in the overall recovery of the woman
Definitely.
postpartum.
Yeah, and we beat ourselves up for like the treats and the snacks and stuff like that, but there is a therapeutic value in being able to like self-soothe ever so slightly, you know what I mean? Especially when all of this stuff is going on. So we're our own worst enemy for torturing ourselves when we kind of go off track, or whatever you want to call it. But that additional stress on the system is extremely counterintuitive to getting to your body composition goals anyway.
1 minute, buddy. Can you close that?
So I think, yeah, keeping things on, if like something doesn't go to plan or something goes awry, whether it be food, whether it be sleep, whether it be whatever, deep breath in and let it go, because us ruminating on it is more counterintuitive to actually getting to your body composition goals anyway. So
Right.
that's, I mean, again, very easy to say, but if that's your continual practice day in and day out, then it gets easier as time goes on. For any of you lifters out there, you know, athletes, you got to practice to get better, right?
Mm-hmm. Absolutely. Yeah, it's like that mind muscle connection. What fires together wires together.
100%.
Now, if any of the viewers are in HRM or area, where can people find you?
So most of my information, like I throw up on Instagram, so it's
Okay.
at sports.dokes. And I don't do too much postpartum stuff there, but I've been asked to speak on postpartum a lot lately, so I might start to do a series for athletes on that. And then also, I work at Proactive in Burnside, so if you know ever.
Oh, looks like we're frozen again. Hopefully Dr. Kokes comes back here. It's about midday on the East Coast, so I think we're the busiest time for probably internet usage. You still there, Dr. Kokes? Okay, we're back. Hopefully this all works out in the end. We froze, and I think we're midday on the East Coast. That could be why. Anyways, carry on, Dr. Kokes, with what you were saying.
Yeah, as I was saying, I work in Burnside. Internet is horrible, so that's probably why we cut out there. And I, yeah, take patients all of the time. Outside of Nova Scotia, there's some regulations where I can't see patients, but I can definitely, you know, do talks like this, or answer some generic stuff for a lot of people too. And yeah, so most of the information, if you're trying to get in contact with me, or if you have any specific questions, you could head on over to my Instagram to get them answered.
Awesome. Thank you so much, Dr. Kokes. Really appreciate you taking the time to speak to these lovely mamas. And now we know where to find you for more information.
Definitely. Yeah. Thanks so much for having me. And like, first off, congrats to all these new mamas. And I'm super excited for you all. And I think like my underlying message is take care of yourself. Like this should be a time of nourishment for you and the baby. And although, you know, all of these social media pressures are to get back as soon as possible, I promise you, long run and longevity wise, the best way to do this is to nourish yourself and take care of yourself for as long as possible, with slow progression, with help from trainers and pelvic floor physio, to get back the newest body that you kind of.
Yeah, beautiful. Absolutely. Thank you again. I'm going to stop recording here, so we'll just say goodbye.